Welcome back to our Business and Community Update series. I am Katie Eaton, President of the Michigan City Chamber of Commerce, and we're so happy to have with us today Dean Mazzoni, President and CEO of Franciscan Health Michigan City. Welcome and thank you for joining us today.
Thank you for having me. It's a pleasure to be here.
Yeah, so we're going to spend a little bit of time today talking with Dean about his background as well as some reflections on the past year and the pandemic and how we're moving out of that, and then also hopeful and bright outlooks for the future. And so we're going to jump right in, as I always do with these conversations, of really allowing you to give us some background on how you landed in Michigan City, especially with Franciscan, and your history with the healthcare field. So we'll jump right in. Dean?
Great, thank you. Well, I joined Franciscan Health in January 2016. The interesting thing is, and my wife reminded me of this, but we've been in Michigan City probably about 10, 15 years before. And when my wife learned that I was interviewing out here, she pulled out a picture of us at the lighthouse with our son, who was just 3 at the time. We lived out in South Bend while I was going to graduate school here. So I didn't even remember that recollection until she pulled out the picture. So it's kind of nice to come full circle and be back here once again, living and working in this community. We love it here, and we're very happy, and we've got just I think such a bright future as a community, as a region in Indiana. So it's a very exciting time to be a part of this. I've been in healthcare since 1990. I started in healthcare leadership around 1995 and just gradually progressed through the ranks with a lot of luck, some great mentors and teachers, and a lot of hard work too. So it's been a great career, and it's a career that has allowed me to be involved in the community in a way that feels like we're giving back and making a difference. So I really appreciate that aspect of it.
So you mentioned you were at graduate school in South Bend. So what university were you at there?
Yes, yeah. So I earned my MBA from the University of Notre Dame in 2002. I had previously earned a master's degree in public health from the Robert Wood Johnson Medical School, which is one of the state schools in New Jersey, where I was living at the time. And that was, I want to say, around 1995. So, and then my undergraduate was at Johns Hopkins University in Baltimore. So.
Very nice. Yeah. We always like to give a shout out to those educational partnerships, right? You know, like I think it's really important to think about the background that you had to take in order to get to where you are. So, and everybody's usually pretty proud of their alum, you know, and where they graduated from. So you were in New Jersey, you were on the East Coast for a while, and that's where you were prior to coming to Michigan City?
Yes, yeah. So my wife and I were born and raised in New Jersey, and right before we moved back to Indiana, we had lived about 10 years in South Jersey, just outside of Philadelphia, where I worked with a fairly large health system at the time, as I said, for about 10 years. And this opportunity presented itself, and it was just really, as I said, we lived out here previously. So as I learned more about Franciscan and certainly coming back to the Midwest, it all worked out for the better. So here we are.
Yeah. What are some of the things that when you thought about, you know, coming back to Indiana, what are some of the healthcare issues that you saw in Indiana, but maybe more specifically to Northwest Indiana, that you felt like you wanted to be a part of tackling?
Sure. Yeah. Well, you know, it's a great question. Indiana, I think, as a state, probably suffers from a lack of public health funding. And so there's a great opportunity there to do more. And certainly the pandemic has put a spotlight on the gaps there and where we really, as a state, need to do a better job. But the thing that really appealed to me here was the opportunity to come into a strong health system that has a statewide presence, and building a new hospital here in Michigan City was a great opportunity. I had been part of a new hospital project in New Jersey where we built a replacement facility, and I had the privilege of leading that hospital shortly after it was opened, the new hospital. And so I was familiar with all that would go into building a new hospital, replacement hospital, and really enjoyed that. Actually, it's just a great opportunity to be able to bring that asset to a community. And so when I learned that Franciscan was building a replacement hospital here in Michigan City, that was really the only other, everything else was falling into place. And then that just was like, that's great. What a bonus. I'm coming, but let's do this. So just a great experience.
Yeah, and so the new hospital opened in 2019,
Yeah.
and often is referred to state of the art, in the region, definitely kind of the top of the line. What makes it that way? What are some of the pieces that went into that hospital that really make it state of the art and top tier?
Yeah, well, there's a whole bunch of things, and not to get too geeky about all this stuff, but the facility itself is very green, so it's environmentally friendly. We did a lot of work to ensure that we minimize the impact to the property here. Most people don't realize we have over 80 acres, but most of it, more than half of it, is wetlands. Actually, almost 2/3 of it is wetlands. That's why the hospital sits so close to the highway. Original plan had it back on the property, but as we did our due diligence, we learned that there was a lot of wetlands back there. We couldn't, but certainly we didn't. We wanted to be respectful of the great land that we had there in wetlands. So we just kept moving it further and further up here, and now we're almost on the interstate. So it's a very green facility. It's environmentally friendly. It's very efficient in terms of heating and cooling and lighting and water resources and water savings and all those things. So that's a big difference, first off, compared to the old hospital, which had sections that were as old as 1926 still. So very inefficient in terms of utilizing those resources. And now we've got great efficiencies in the new facility. Secondly, the hospital is designed for the future. So it's laid out in a way that makes more sense, better sense for patients. It makes it easier for patients. We've kind of got on-stage or patient, public space, and then off-stage or backstage space where our team works, our care team works behind the scenes. And again, with the old facility, it had been cobbled together over time. As I said, the oldest section was 1926. The newest section was 2001. And in between, we had different additions that came together. So it was almost like a patchwork quilt. Lends itself to a lot of inefficiency and makes it difficult for patients to traverse and visitors to get through the facility, difficult to find things. So the new hospital is very nicely designed with access and patient convenience in mind. We've got a main entrance for the inpatient side of the hospital, and then we've got another main entrance for outpatients and physician offices visits, and then we've got an emergency department entrance. So 3 main entrances makes it very easy, convenient, and accessible. And then, of course, the technology. We've upgraded all of our diagnostic and clinical equipment, moving over from the old hospital to the new hospital. And in our ORs in particular, we've got, as you pointed out, state-of-the-art equipment, and I'd say 21st century equipment in terms of what we're able to do with communication and keeping people safe, clean, sterile environments. Our cardiac catheterization labs, the same brand new state-of-the-art equipment, all of our diagnostic imaging equipment. So just bringing all of that technology right to the patients and making it available to this community, even down to our patient rooms with the surfaces that we use. Of course, all pre-pandemic, but we selected surfaces that minimize the risk of infection or spreading infection. We've got motion-activated hand washing stations in all the patient rooms. So just different advancements like that really make a difference. Simple things like blinds integrated in between the windows so that they don't collect dust and increase the risk for the spread of infections. So those types of advancements, from small to very big and very expensive, make this a hospital for the future.
Yeah. So you talked so the hospital opened in 2019, and there was a lot of transition that I'm sure many of the staff people, nurses, doctors, everybody had to go through as they were learning this new facility, new technology, whatever was going on. And probably right as they were getting used to that, we end up in a pandemic in the early parts of 2020. Talk about what are some of the operational changes that then had to go in place in order for the staff to deal with the pandemic, and what of those are still in place?
Yeah, sure. Well, certainly for all of us, a life-changing event. And I think for me, the most anxiety provoking, there were a couple things very early on that had my attention. One is I have a lot of colleagues still in the Northeast, and as you know, as everyone knows, this really started in New York and spread across the country. And so I was getting reports. We were relatively unscathed here, but getting just these horrific reports back from my colleagues out on the Northeast in New Jersey, New York, Pennsylvania. And so it was almost like watching a tsunami approach. You could see it coming, and you tried to prepare for it the best you could, but you just didn't know what you were ultimately going to experience. And then it, of course, arrived here in March. We started seeing our first patients. And the good news is, because of that early warning, we were able to learn from our friends out on the Northeast and put some things into place, make some changes very early. But some of the things that we didn't expect right out of the gate here were the impact to the supply chain. Very concerned, again, early on about our staff's ability to be protected. And that was something that my team worked tirelessly on, even across the whole Franciscan Alliance. But just having access to face masks, gloves, disposable gowns, hand wash, sanitizer, those things, very quickly, those things started to disappear. And we recognized that we had to take some steps to make sure we could make it through the pandemic and not jeopardize patient or colleague safety here. So the team here redesigned the way that we distributed those supplies. We put together what we'll call a central store for those PPEs, and that's personal protective equipment. And we would, every day, we would hand out masks and gloves, and depending on where you worked, and if you were working specifically with COVID positive patients, you'd get N95 masks. If you weren't, you wouldn't get N95 masks. Some people, like myself, I would get a cloth mask. We wouldn't even use the good surgical masks. You probably can't see that on people like me, because I wasn't interacting with patients regularly.
Yeah.
And that's where the community really stepped up for us. It was so nice to see that support. It meant a lot to our people from a morale perspective. But the community started making masks. We had the local schools, the robotics team here in Michigan City, Ivy Tech. They were printing on their 3D printers face shields for us, which was just what an incredible gift.
Yeah.
Because we were running out of that stuff. Quite literally, we were running out of that stuff, and the community helped us through that, and it made all the difference. And then we would come in, and the driveway, which is quite long, would be lined with signs of support. We would leave one night and come in the next morning, and these new signs would be out there. And it was just very uplifting, and it just really made a great deal of difference for the team here.
Yeah, and much needed. There definitely was a lot of that community support. Emotional wellness and emotional well-being, especially for leaders like yourself who are concerned about their staff and their colleagues on their emotional well-being. What are some of the things that you guys have maybe put in place to just check in with employees and make sure they're okay?
Well, yeah, great question again, Katie. We've done a lot. We've always rounded on our staff. It's part of our standard work, or what we call our leader standard work. We use a lot of lean here, continuous improvement to make gains for the positive. But our leader standard work includes rounding on employees, purposeful rounding. So we've always done that, but we had to step that up through the pandemic, because we wanted to make sure we knew what their challenges were, what their issues were, and we wanted to make sure we could do everything to support them. Our philosophy here is, if you're not taking care of the patient, you need to be taking care of the person that's taking care of the patient. So getting out and being visible and asking questions, and then making sure the team has what they need was very important. So rounding is a big part of that work. We spent a lot of time meeting and planning. As a hospital, we do a lot of drills. We do a lot of emergency management exercises. And so that infrastructure was already in place here. So it was very easy for us to kind of react to the pandemic and already kind of flip the switch on that infrastructure that we drill and practice with. And so we stood up what we call our disaster control plan and our emergency management plan. And we were able to, in real time, take feedback in, learn about where some of the challenges were, and if we didn't already have a fix in place, to react and respond and make those changes quickly. So that was good to be able to demonstrate to the staff that we were in this with them, we're working through the issues and the challenges, and helping them along. We also have a very robust employee assistance program here. And so bringing in our experts who are, professionals in dealing with stress, anxiety, and fatigue also helped, having those resources available to our staff. We made a concerted effort to try to do as much as we could around keeping a sense of normalcy. So even though we would be masked and have face screens on, when it was still warm out, we had an employee picnic outside, and we made sure that we socially distanced. We had hand wash stations all over the place, but we made sure we did that. And likewise, we have a robust reward and recognition program in place. And one of the things we do every year is our annual service awards. Normally, we go out to the blue chip and we have a big dinner and celebrate. Well, clearly we couldn't do that, but we put something in place. It was like a walkthrough function where people could come through, and the administrative team was there, and we recognized people individually. It actually worked out really well. People really appreciated it. The feedback we got was, thank you for not missing this opportunity. It was important to me. Thank you for making sure that you did something. And we were just glad that we did it. And our HR team, led by Steve Kyle here, the whole team put that together and did a great job. So we tried to keep things as close to normal as we could under the circumstances, because losing that human, we're in the interaction business, and to lose that personal touch is tough.
Yeah. So let's talk a little bit about some of those maybe lessons learned or things that you've put in place through the pandemic that you don't really foresee going away, and what can some of that translate into other organizations, other businesses, or even into the community?
Yeah, well, that's a great question too, Katie. I think that we put visitor restrictions in place early on, and my, if I have one regret, it's that we probably overreacted there. And what I mean by that was, early on, we closed the facility to visitors completely. And as I said just a few moments ago, we're in the people business, and to be sick in bed and not to have a loved one with you is just a terrible way to have to experience healthcare. And so I think we learned from that, and we loosened visitor restrictions since that time. And through the second wave, we didn't close visitation completely, although I will tell you there was a great push to do that. But we just learned from the first pass that you really, family and friends are an important part of the healing process, and we needed to keep that intact. So we did it. I think we did it in a safe and responsible way, but we did keep, with some restrictions in place, family and friends coming in. The biggest lesson for us, I think, is things like hand washing. We've always measured hand washing my whole career. Wherever you are in healthcare, you're looking at how frequently people wash their hands. And the truth is, I'm a little bit ashamed to admit this, but it's an industry issue. It's not our issue. People just don't wash their hands either enough or well enough. And the pandemic changed that. And I'm hoping that stays around. People have really improved hand washing in the facility. They're constantly washing their hands. And we've made great strides in that regard. Franciscan is actually in the process of acquiring some new technology that we'll have here this year that will actually, it's again, through Bluetooth technology, we'll be able to measure and monitor hand washing more effectively. Right now, we do it through direct observation. So we're going to be able to up the game on our end, but I think people in general have just done a better job of hand washing. And I think we're going to continue to see that just across the country. It's like seatbelts. When I was a kid, nobody wore a seatbelt. Now it's second nature. You almost feel like you're naked if you don't have your seatbelt on in your car. And I think hand washing is going to be similar, a change that is going to be around for us for a while.
Yeah. Do you also foresee, people in the community who, when they are feeling a symptom of any illness, that maybe they're more apt to pay attention to it and not go out in public? This is typical time of year for flu, and I don't think it's been as high. So, there's some other ramifications that have been positive from this as well.
Yeah, absolutely. I do think, that in this country, very rarely did we wear face masks. And I think now that's kind of part of the way we're going to be going forward. Even if we get away from, say, the vaccines finally reach a herd immunity levels, I think people will still, if they're not feeling well, probably put on a face mask. It'll probably almost be like a, a social expectation uh, nowadays and going forward. I do worry that a lot of people in our region, in our communities, even pre-pandemic, probably would go to work sick because they have to, right? They don't get paid time off or sick time, or so I think socially and even probably legislatively, we'll all be looking at that a little bit more closely too, to make sure that we have the steps in place so that if someone's sick, they can recover safely at home and not feel forced or obligated to come in. So those are probably some changes that we might see also.
Yeah. So the vaccine has been out for a couple months now, or a few months. I saw today they just dropped it in the state to 45 years of age and up. Teachers had started getting vaccinated this week, and other demographics as well. It's safe. Talk about how important it is for people in the community to get that vaccine when it's their turn.
Yeah, yeah. Well, it's very important, and I understand that there's some hesitancy out there, and people have questions. Uh, I know there's a lot of resources out there as well. You can go to the county and state websites. You can go to the CDC website. You can go to the Franciscan Health website, and we've got Q&As, FAQs, frequently asked questions about the vaccine and its safety. And so I encourage everybody to get as much information as they can and answer any questions they might have. But the vaccine has been demonstrated to be safe after thousands and thousands of administrations. And so it really is the best defense we have in preventing the spread of this new virus. And that's the biggest problem that I see, is that this is a new virus. We don't have natural immunity to it. Until we can reach those levels where we will naturally suppress the spread of the virus through immunity, there's still a risk for people, especially people who are in those high-risk categories. And you may feel healthy and be young and not really suffer the consequences, but you could spread it to someone else who could really suffer. And we've seen examples of that here in the hospital. So I encourage people to do their homework, have their questions answered, come to the hospital website. But yeah, you really should get the vaccine. It's currently in what we call emergency use authorization right now. So which means there's essentially 4 steps to get a drug or vaccine approved through the federal government. To be in an EUA status, emergency use authorization status, you've gone through the first 3 steps, and all that's pending is that 4th and final step. And I expect that we'll get there later this year with that step. But the EUA status allows the government to push out the vaccine and be confident that it's safe and people really shouldn't suffer from it. The side effects are really what you might experience from a flu vaccine: sore arm, slight fever, achiness, maybe a little tired. Those were all the side effects I felt after my second vaccine recently. So, it's worth I think the cost benefit has been demonstrated there already. And I really would encourage people to get their questions answered. But when you're eligible, sign up and get vaccinated. Really, and I guess I should say selfishly, the only path I see to us getting back to some new sense of normalcy is to reach that herd immunity through vaccination. And if people want to get rid of the face masks and get back to socialization, we have to do that.
Vaccine is the way to go.
Yeah.
Yes, for sure. All right, so let's transition to looking into the future. There's probably already some progress being made in this area, but let's talk about the North Campus here in Michigan City that you guys left when you were after building the new campus, and the plans for that. There's been some demolition that's occurred already. What's the future for that area?
Yeah. Well, like the other hashtag that I keep hearing, and you and I talked offline about mute fail, right? The other one is, kind of blame it on COVID, and that's the reason we have delays and so on. But we really did have a delay in the demo of our Homer Street campus because of COVID. We had another delay that was unexpected, and that was around moving some utilities and infrastructure in the facility. We rely on our partnership with some of the utility companies to get some of that done. And so we're not as far along with the demo as we thought we would be by this time. But yes, the medical arts building that was on the corner of Ripley and Homer Street is down. So that's completely taken down and is getting ready to be scrapped. The rest of that facility will be, actually, we should see some more activity this week, and certainly by next week, the demo will begin in earnest there. And at the end of it, which will be probably later this summer, early fall, about 2/3 of the facility will be gone. And we plan to convert all of that space back to green space. So we're going to plant grass and
Nice.
maybe even have some walking paths through there. That's the immediate plan. The portion of the building that will stay is the old emergency department, and the newest patient tower, we call it the 2001 building, which is 5 stories but has 3 floors of patient care space. And our plan is to move our behavioral medicine unit over to the 3rd floor of that patient tower. On the ground floor, the PACE program will be going in this summer, and PACE stands for Program for the All-Inclusive Care of the Elderly. So it's a program that is designed to keep older residents out of skilled nursing facilities and in their homes longer, so they can come during the day and get the care they need, the medical care, the socialization and activities, and then at night they can go back home, presumably when a caregiver might be available, and they can live in their homes longer than have to go into skilled nursing and long-term care. So we're really excited about that program coming on. We've done that around the state at other Franciscan hospitals, and it's been very well received.
Yeah. And can we talk about the importance of keeping, elderly in their homes? Longer life expectancy, quality of life, that's the reason?
Yeah, all those things. And, certainly the pandemic's done a lot of things, and it's one of the things it's done is shown a light on where some of our shortcomings and weaknesses are. And when you look at the deaths in this country, almost half of them, just under half of them occurred in nursing facilities. And that's not their fault. It's just the congregational living, the community living environment that they have makes it more susceptible to the easy spread of a virus like coronavirus. So, I think, again, keeping people at home and they're happier, their well-being is higher, and as you said, they're less likely to maybe get sick or admitted to a hospital, and so those are all the reasons to do it.
Yeah. So the PACE program will be there, behavioral health. Any other departments moving into that area then? Yeah,
we're looking. It's probably premature for me to make any specific announcements, but we use our community health needs assessment and, of course, our organizational mission to drive the repurposing of that Homer Street campus. So to that end, looking at how we might expand services around behavioral health, looking at potential partnerships for drug and alcohol treatment programs there, and also looking at the instances of food insecurity across the city and how we might address some of those things through that campus as well. So it will certainly have a community health improvement focus. So looking at what types of programs we might bring over there to address maternal infant mortality, for example, and healthy babies. So those are kinds of the things that are getting a lot of serious attention from us right now for the Homer Street campus. I will also say there's a lot of interest from developers in the property that will be available once those buildings come down. So there's over 10 acres there. It's close to the lighthouse, outlets. It's close to the new train station. You can see the lake from the 5th floor, so we're close enough there. So a lot of interest from developers, a lot of speculation around what might go there, like assisted living or other types of housing, perhaps. So more to come. It's exciting, really. I think there's a great potential there.
Yeah, I would definitely agree. There's definitely great potential. It's a key location, as you mentioned, close to the outlet mall, close to the downtown, close to the soon to be renewed 11th Street train station. We just had an informational session with Nick Deed, and everything is on track to, for that project, and really is a game changer for that area of Michigan City, and the potential revitalization of those neighborhoods surrounding that. So I want to give you an opportunity to talk about any other significant upcoming health and wellness community initiatives that you guys are working on, whether it's this year or even into the future, that you really would like to touch on. And if there's key partners that you want to make sure that you're mentioning, I want to give you that opportunity before we close up today.
Yeah, thank you. Well, certainly our Franciscan Beacon Hospital, when you talk about partnerships, is off to a great start. We actually just finished on Friday one of the accreditation steps, a big milestone for us with the Joint Commission. We had a successful survey, so we're anticipating that we'll have accreditation of that facility very soon. And that really opens up a lot of different avenues for us there once we get that accreditation in place. But we're off to a great start, despite opening 2 days before the 4th of July and then working through this pandemic. The facility's been doing very well, and the feedback from patients in the community there has been exceptional. So we're really proud of the team over there and the work they're doing, and really just the partnership has been incredible with Beacon Health, and just being able to provide access for that community to our specialists and their specialists has been, I think, a game changer for the city of LaPorte, and we're really happy to be involved with them there. We've added a number of physicians to the community, a number of specialists, a number of primary care physicians. So the Franciscan Physician Network grows by the week. It continues to grow.
We see those press releases. They're constant. It's somebody new coming on, new specialists. It's awesome. It's great. Yeah, it's great.
Yeah, when I first got here in 2016, one of the early kind of realizations for me was that our primary care base was aging, and we had some gaps that we needed to fill. So we made a concerted effort to bring new primary care doctors into the community. We have a number of great new doctors who joined the existing primary care doctors here, and access to primary care, I'm happy to say, is not an issue for Michigan City, for LaPorte, and for Chesterton. We've got more than enough primary care docs, I believe, to serve that need. But when you have primary care docs, then you also need specialists who are going to receive those patients for primary care docs. So we've made a big push around 3 areas primarily: cardiology, oncology or cancer services, and surgical services. And we've added a number of specialists across those 3 areas, and they've really just been a great addition to the community. And we're just poised for what I think is going to be really a bright future for Michigan City and for this region. Medically and from a healthcare perspective, we're really positioned very nicely. So very excited about the team here and the new doctors and the new services that they've been able to bring in. We now offer bariatric surgery here, which we haven't had here previously, and that program is off to an incredible start. We have cardiothoracic surgery here that's really doing well. We have got neurosurgery now through a partnership with Beacon Health, and they do spine surgery, which we really didn't do a lot of. From a neurosurgical perspective, we have orthopedic spine surgeons, but neurosurgically, we didn't have that. So just a number of great additions to the team, and really excited about the new services and programs we're able to offer as a result.
Great. Well, I really appreciate you taking the time to chat with us today. We are, I here at the Chamber, we're truly grateful for the partnership that you have with us and your continuous support of not only the Chamber of Commerce, but, you also serve on the Economic Development Corporation Board, and that you are truly invested in this community, both yourself and, as, from the hospital perspective. And so grateful for your time that you give, and thank you for your time today. And until next time, thank you so much.
Thank you. Thank you for all that you do and for all that you do with the Chamber. You're making a big difference, and we really are grateful for your leadership in the Chamber. So thank you.
Thank you.